it's alive, it's natural. You know, often enough, it's available in abundant supply. And we use it to rebuild areas of the body that might want to get more volumized, such as buttocks, breasts, dents anywhere, cellulite dents as an example, and especially the face. I have a little micro cannula here. It's not a needle, and it's in the space below the orbital rim right now, up against the bone, and I'm laying down little channels of fat to help restore some youthful volume to the upper eyelids. So even though, you know, we often do surgery to trim the upper eyelids, or surgery to lift the eyebrows, or surgery to trim the lower eyelids, there's still volume loss, and so there are areas that like to have volume replaced. Underneath the orbital rim here is a place. I've done a bunch of fat grafting here already. I put some here under the orbital rim, right up against the septum of the lower eyelid. I used this little entry point here, put my finger there to protect it. That's going right up to this edge right here. You can see I put some little red dots in there, but that was sunken in. Now it's improved. I put some in the pre-jowl notch. I put some here on the angle, the ramus of the mandible, and helped build up this area here. Used the pre-auricular area, the buccal area. I put some in the mid-face. I put some in the chin. And I've sort of done all of the things that I'm happy doing at the moment with micro fat. And I'm going to switch to nano fat. So I use these different sizers, tulip sizers, and I work the fat from micro, little by little, going back and forth here, here, here. So I'm on the final one of these pieces. You can see it's a tulip, and this goes back and forth, making it smaller and smaller and smaller. And then finally, I will put it through the nano sieve, which I'll show you here in just a moment. And then I have extremely fine fat. So our patient, for example, has a little bit of some fine cross-hatching here, and I'm going to use some nano fat in that fine cross-hatching. It's great in the lips, it's great in the temporal wrinkles, you know, the crow's feet. All right, I think I'm about ready to go nano. All right, wish me luck. Here we go. We now have nano fat. You can see it's even a little different color. That was micro fat. This is now nano fat. Could I have a 30 gauge, please? That's perfect. Yes. This is actually a very tiny bore needle. It's a 30 gauge needle. I don't know if you can see that. It's pretty tiny. And so this fat will probably flow through that needle. You can see it's coming there very slowly, right? Very fine. Okay. So there's a little mental crease here. So I'm putting this fat very superficially under the skin, kind of intradermal plus deep dermal, maybe slightly subcutaneous, but I'm working in a very superficial manner in order to help plump out this wrinkle. You can see in some cases the fat was squirting out a little bit through some little numbing pokes I made. So you can see that this submental crease here, I was going to say is getting younger, and that's exactly what's happening. I mean, the reason we're doing something anywhere is to help people look younger, and with time this crease gets deeper and deeper. It's one of many areas that we can work to bring back a more youthful look, a more youthful volume. Nano Fat, our patient's own fat. I think you can appreciate this area is getting nicely smooth. These, by the way, are not a result of today's procedure. These are a result of wearing masks because we're in COVID times and masks, right?
Right.
Yeah. And masks just, maybe they help you not get COVID, but they're not helping much else. I guess maybe for bank robbers it could be good. I don't know if robberies are up or down. Everybody's got a mask. What's the fun, right? So anyway, today I showed you a little bit of fat transfer to the face, autologous fat transfer, fat grafting, all the same thing. Showed you micro fat, which is kind of the robust substantive part, and I just showed you the manufacturing of and using of some nano fat for very fine detailed things. I'm going to continue to work on some of these fine cheek rigidities, or wrinkles as they're called, and I'll do the crow's feet area and also a little bit here under the orbital rim. Also, our patient is going to have a CO2 laser procedure a little bit later this year. In general, we try and work most of our laser procedures, especially the substantive ones, such as the Fraxel CO2, Fraxel repair laser, other CO2 lasers, thulium lasers, any of the ablative lasers. We try and do those not during the summer, but after the summer, and now it's almost after the summer, so it's about time to do a whole lot of lasering for our patients. Hopefully, they didn't damage their skin very much, hopefully at all, this summer. That's a wish. So, thank you for watching. The team at MilfordMD, Fat Transfer.